evening, everyone, and welcome to our third monthly Communities Conquering COVID Town Hall. We are so excited to be here this evening with our incredible set of panelists from across the state of Michigan, all faith leaders, all community leaders in their own right, who have taken their time out of their very busy schedules to share their perspectives, their wisdom, their expertise, and lessons learned through their journey with COVID, with their congregations and the communities in which they serve. We are also very excited to welcome back Dr. Sandra Cinti, our very own infectious disease expert from Michigan Medicine, who has generously been here with us for all of our town halls, bringing to bear his expertise on the virus. I want to go ahead and get to everybody's questions, but I want to start by introducing our panelists. And after introductions, I would like each panelist to just spend a couple of minutes sharing with us the impact that COVID-19 has had on your congregations and your community. But first, brief introductions. We are very pleased to have Father Ameer of St. Mary's Holy Apostolic Catholic Assyrian Church of the East, Pastor Monica from Salem Lutheran Church in Flint, Pastor Waddles from Second Baptist Church in Ypsilanti, and Pastor Williams from Historic King Solomon Baptist Church in Detroit. My name is Erica Marsh, and I am very pleased to be your moderator this evening. And why don't we start with you, Pastor Monica? Can you share for a few minutes how COVID has impacted your congregation and your community?
Thank you for everyone attending today and for taking time out of your evening to join this discussion. And it's wonderful to be on this panel. So I thank U of M and MICHR as well for putting this together and initiating the invitation to be a part of today. I serve in the Flint community. I serve a historic church on the north end of the city of Flint. And during COVID, we, of course, like many congregations, have suspended in-person worship and have had to learn utilizing technology like Zoom even today. But we've also had to learn how to do YouTube and different ways of outreach and kind of revamp, how we engage in spiritual care, pastoral care, and community care. As a matter of fact, even during this time of COVID, I had a colleague who resigned from a local congregation so that he could tend to his own health. And as a result, it meant that as I am the next closest pastor, I have now been assigned to a suburban congregation as well. So it means part of this has meant that we as professionals, as pastors, that we care for one another in the profession, and it means that we often will share ministry duties with our colleagues in other congregations as well. And I think the pandemic has really heightened this interconnectedness and the need for support, not only in community, but among parishes and congregations. In the Flint community, we are very much impacted still by the Flint water crisis, and this pandemic has only exacerbated the inequities that we have seen, both in terms of health outcomes, but also in terms of access now to the vaccine itself. So a lot of my work has been building off of what occurred during the water crisis and the infrastructure in the way that the faith community responded during the water crisis, and kind of reigniting some of those efforts. So it's the faith community is still very vital to how our county, Genesee County, is really taking on this pandemic. And we've done that from a multiple perspectives, which I'm sure I'll share a little more later today in the webinar. But in that role, I serve as the co-chair of the faith subcommittee for the COVID-19 task force for the county. So we are doing some very innovative things here in the community.
Thank you so much, Pastor Monica. Father Ameer, You're muted, Father Ameer.
Now, okay. Thank you for having me for this night. I really appreciate it, what you guys do, especially in this period of time. I believe in the beginning of this pandemic, we all, as a churches, not only as a churches, as a community, we saw some a big impact within the church. We suspend a lot of services for many months. Actually, we were doing our service online. Live streaming within our community, especially on Facebook, on other web that we were actually connecting each other. And still within this kind of period of time, we didn't actually stop. We didn't actually stop our connection with our people, especially this period of time. I believe the disease wasn't that easier for all of us, especially in the beginning. The stage was more difficult because we don't know and we don't understand the disease and its impact. And that's make us some big impact within our community. And a lot of people, they were infected with it. A lot of people, they were actually afraid with it. As a church, as a community, we were close to them, contact with them, and most of the time go visit them, even if there were some social distance between us and the people. They were actually trying to reach them. Talking to people with this kind of pandemic was very, very, very important, because I believe that disease was more than the physical disease. It also as a mental illness, where a person enter into deep thinking for the sake of the family and its continuation. I believe that's why the psychological activity, it's important to strengthen the body's immunity to fight the disease and get rid of it as soon as possible. That's why within this kind of period of time, actually, we were working with our people, guiding them within social distance and do some, let us say, we call it some cleaning their hand or all those stuff. And now, and thank God, you know, this period of time, a little bit is, it's more, let us say, useful for us better than beginning. We see people within the church, I believe with the guidance that we have within the church, how they coming to the church, how they supposed to lead the church. And I believe there's many changes that we did with as our tradition, as a virtual tradition that we do it within the church. Hopefully this period of time with the vaccine that we've seen it now, we can actually see the end of this pandemic and go back as we were before, especially this period of time last year. Within this year, the church was closed, and we seen that Easter is coming and there were no people within the church. That was very hard for our community, really. But hopefully this time will be more useful for our community and get rid from this pandemic. And our prayer also, it's always, you know, for the community, for anybody to be safe, and especially our doctors, our nurses, those that were working in the front line. We really appreciate them. We really appreciate what they did for our community. And those experts, they were actually working with this vaccine that we've seen it now. I got the first dose with this vaccine. Hopefully I will get the second one and the last one in the beginning of the next month. Hopefully we get rid from this pandemic. And thank you again, and God bless you all.
Thank you so much, Father Ameer. Pastor Waddles, could you share a few words about the community you serve, your congregation, and the impact of COVID?
Sure, thank you. And I serve Second Baptist Church of Ypsilanti, Michigan. We are directly in 48197. And our community was impacted greatly by the virus almost immediately when one of our board members who actually lived in Detroit or near Detroit became ill and passed away. That was in, I think, March. His mother-in-law became ill and passed away within the same week. His father-in-law became ill and passed away the next week, and his wife became ill, but she survived, but with long-term issues. That was our initial introduction to COVID. None of those folks got sick because they had been at our church at Second Baptist. And so for a year, we had strict policies as far as the church was concerned. Our food pantry, we had to change the way that we did that. We were already a hybrid online and in-person worship service and other teaching opportunities that we streamed, but we had to pivot on some of that and do it in a better way where more people had access. But recently, just in the last couple of weeks, we had a situation where two people met together in person, and because of that, somebody got sick, and then it spread to a couple of other people. And so we had to even more narrowly focus how we do everything. That has impacted our community, especially our young people. We used to have a large group of young people that would come out every week, about 40 of them. We tried to go virtual, but they're Zoomed out. And the biggest impact has been on families, the social isolation and distancing, and trying to keep people encouraged. And then, as clergy, we deal with death all of the time. But the number of deaths in our community has been unprecedented. And so ministering to, as Pastor Ameer said, the emotional side of what people have had to deal with has been tremendous. And then trying to connect people with resources. Where can I get food? Where can I get help with rent? Where can I get help with my mortgage? How can I get the technology to connect my family? And then recently, how can I get vaccinated? And so we've been very involved in all of that, especially vaccination. And we're grateful for partnership with Michigan Medicine and Hope Clinic and others who have helped us with that. So that's how it's impacted us, and we're continuing that fight. And because we believe if you serve the whole person, you have an opportunity to express to them the love of Christ.
Thank you, Pastor Waddles. And last but certainly not least, Pastor Williams, could you share a bit about your congregation and the impact of COVID?
Well, good evening. Charles Williams, King Solomon, historic King Solomon Baptist Church in Detroit. Look, the old adage is when white folks catch a cold, black folks get pneumonia. I would say that in 2020 and 21, when white folks get pneumonia, we get COVID and we die. 40% of the city of Detroit is in poverty. 60% of the children in the city of Detroit is in poverty. So not only have we been killed and we have suffered high mortality rates and high morbidity rates by COVID-19, but we are also suffering through the social ills in the city of Detroit. I tell you, when King Solomon Baptist Church first entered into this whole COVID-19 thing last year, we sprung right into action because we realized one thing: there are a lot of folks who are immobilized throughout the whole entire city. We have senior citizens who could not get to get to the pharmacy. We have folks who could not get out to get meals. We delivered over 750,000 meals across the city of Detroit. These are not, these are meals that, folks had to access by way of driving up, as well as we had to deliver them. We made over thousands of deliveries to senior citizens. We went and we picked up medicine. What this has done for the church is it has shaken our role from just being a spiritual center, but a social space and a social center that delivers on behalf of those who need it the most. Brookings Institute says that Blacks are significantly more likely to die and contract COVID-19. It's been happening. Our rates are higher. I've had several funerals that I couldn't even walk down the aisle with the families with. I know Dr. Waddles understands and Dr. Ameer, Reverend Ameer understands. This has been our challenge. This is what we've been faced with. And on top of that, we've got almost 60% of the city of Detroit who are renters. They are renting their homes. Right now, they're under a moratorium. No one knows what will happen when the moratorium is over. No one knows if the landlord will still own the house because of tax foreclosure. No one knows if the landlord is ready to kick them out the house right now. We've got residents who are concerned about whether they actually earn enough money, but they don't earn enough money. And although there are unemployment benefits and there are stimulus, we know that that doesn't last forever. And so folks are in a real bad place, not just running from COVID, but running from economic disaster, running from what we know to be a huge gulf of poverty in the city of Detroit. And so what it has charged us to and changed our ministries into is social centers, social service agencies. We're employing testing. We're trying to push the vaccine. We're providing meals. We're doing everything we possibly can while at the same time we're remaining our services virtually. But I tell you, all of what we do and all of what we have tried to do, it will be for naught if we're not able to access the stimulus dollars that were sent down to municipalities across the state of Michigan, but more importantly in the city of Detroit. The city of Detroit got over $800 million from the federal government. Wayne County got $350 million. That's $1 billion of COVID-19 stimulus dollars that was spent specifically trying to see if we could stem the tide of everything that's going on. Now, I know that many people saying, what this got to do with your church? Well, if there are no folks who are able to live in these communities that are able to survive and thrive, then church doesn't mean anything. So we are very concerned about employment. We're very concerned about housing. We're very concerned about how they're going to meet their needs. Look, social vulnerability index areas like the area that I serve in, where folks live in public housing, is heavily impacted by COVID-19. And unless we begin to teach our dollars some sense and move our resources in spaces where we can actually stem the tide of COVID-19 and decrease the hesitancy, then we'll merely just be chasing good after bad. I'm afraid that our communities will be left behind. I took the vaccine, I took it fast. It was one of the first people online because I had to go back to my community and share very clearly that this is important, but there's so much more that needs to be done. And we've got to make sure that we hold our governments accountable to do it.
Thank you very much, Pastor Williams, and all of our esteemed faith leaders. We're going to shift gears a little bit and direct a couple of questions to Dr. Cinti before we come back to our faith leaders. But before we do that, I'm going to ask Angelica Snyder to translate a very important message. I'm going to have to pause and let her translate, but normally for this event, we have a channel for Spanish translation.
Comúnmente para este tipo de transmisión tenemos un canal dedicado especialmente a la traducción en español, perdón, la interpretación en español.
And that had been our plan for the event tonight, but unfortunately we are having technical difficulties and our Spanish channel are not able to access our Spanish channel.
Desafortunadamente, dado a dificultades técnicas, no nos ha sido posible tener la interpretación en español, ¿sí?
Please know that we will be providing or obtaining a translation of the transcript from tonight, and we'll make it available to anybody who requests it in Spanish.
Por otro lado, es importante recalcar que tendremos una traducción al español disponible que vamos a sacar de la transcripción del audio de esta presentación, el cual estará disponible para aquella persona que lo pida.
Equitable access to this type of information is very important to MICHR and to the other sponsors of this event. And we will continue to work hard to make sure that translation is live and available at our next town hall.
Entonces, un acceso equitativo a esta información que estamos proveyendo aquí sabemos que es importante. Por lo tal, haremos todo lo posible para que esté disponible para la siguiente town hall.
Thank you very much, Angelica. I appreciate it.
Very welcome.
So Dr. Cinti, we have a couple of questions that I think are at least I'll initially position to you, and certainly if any of our other panelists have anything to add, we welcome that. But could you further explain CDC guidance for those who have been vaccinated already? Specifically, do I still have to wear a mask? Do I still have to social distance?
Yeah, those are great questions. Can I make one comment? I just feel humbled being in this crowd here. I feel I have a small part of this, which is trying to get people vaccinated. But all of you, I go home at night at home, and I can put these things aside, and all of you are living right in the communities and having to deal with all these issues. So thank you so much, and it's great to be here. And so for my little part here, getting people to get vaccinated, happy to do it. And on that question, Dr. Marsh, it's a great question. What the CDC is now saying is if you're vaccinated, fully vaccinated, and that means you've gotten 2 shots of Moderna or 2 shots of Pfizer or the 1 shot of Janssen, and then you're 2 weeks out from that, you're fully protected. In those situations, people can go into families and Joe Biden was saying this the other night, President Biden, that you can go into your family situation if there's nobody at high risk. So grandparents who are vaccinated can go in and take their masks off and hug their grandkids. People can go into their family situations where there are younger folks and who aren't at risk. If somebody's at risk still and hasn't been vaccinated in the household, you still should wear a mask even if you're vaccinated. People who are all vaccinated can congregate together. So I know friends of mine are going to March Madness and meeting together because they've been vaccinated. But if there's one unvaccinated person there, if they have a risk factor, they can't be part of that. Those recommendations will continue to change from the CDC. So right now, it's encouraging news that some of us can take our masks off in certain situations, but we really need to get more people vaccinated.
Thank you so much, Dr. Cinti. I think related to getting more people vaccinated, I'm gonna actually turn this next question to our 4 faith leaders, but also would like to get your thoughts on this, Dr. Cinti. One person has written, I keep reading how Black people are hesitant to get the vaccine. I'm not hesitant, I just can't get access to it. Why do they keep saying we're hesitant and not giving us the vaccine?
I'll be glad to address that. One thing that I found out is there's some truth to that. And I'm sure that Pastor Monica and Pastor Ameer and Pastor Williams can agree with me that the issue of hesitancy, we've kind of started turning the corner on. And that most people recognize that they may not know what's in the vaccine, but they don't know what's in their fast food, their peanut butter, or if they unfortunately may have been a person that used recreational drugs, they didn't know what was in that either. And so we're starting to turn the corner on that. What we have to turn the corner on is availability, access, and information. And so Second Baptist has worked hard to, as I know many of us have, many churches have, to connect people to resources where they can get vaccinated. But there's a digital divide. And today I spent 15 minutes on the phone with somebody trying to help them text a code to a number to get. And I said, this doesn't work for this person. Let me give them another way. So those are the kind of issues, access issues, connecting people, especially seniors, with how do I get vaccinated? Because as healthcare providers and as people who are consumers of technology, as many of us are, we assume email, we assume text capability, we assume a smartphone. And in many cases, many cases, and I'm on the south side of Ipsy, that infrastructure is not there. So that's the piece to me that we have to help people with, is let's get the word out about how people can get vaccinated so that the person who asked the question, it's answered. This is how you do it. Here's on our webpage, here's on our Facebook, here's on our Twitter, here's on our whatever, our website. Here's how you can get connected.
Thank you, Pastor Waddles. Any of our other guests would like to respond to that and share what the in addition to the technical divide, excuse me, what are the hurdles? Is it transportation? What are the needs to be beyond technology to help people get vaccinated? Can anybody speak to that?
So I could jump in here. First, the thing I will say is although this individual may not be hesitant no more, hesitancy is real. 60% of Detroiters surveyed in the Detroit Metropolitan Area Community Study say that they are hesitant and they don't want to take the vaccine. The only reason why I'd tell you that stat is because I was in a meeting earlier today with a healthcare clinic in Detroit, on the east side of Detroit. And they told me, Reverend, we get about 50 reservations a day of folks who reserve a spot for a vaccine. And almost just about 10 people show up. This is what this clinic is telling me. And I don't want to put the clinic out there because I don't want them to feel like they're being pinpointed, but it's real, right? But on the other end of that, governments really need to do a better job at the way that they're doing vaccines. Look, you can't keep trying to cattle herd folks into vaccine. TCF was fine. That works for the folks who want to go get vaccine. But people who are a little bit more tepid might need to be a little closer to home when it comes to going to go get a vaccine. Can I go to my community center? Can I go to my local church? Can I get access and availability to a vaccine much closer to me than going down to Ford Field? The Assistant Secretary of the Department of Homeland Security is coming to Detroit tomorrow, invited me to a meeting, and we'll be talking about this. And they even recognize, look, we're having this Ford Field open, but really this is for the metropolitan area. If they're going to get vaccines to the community, they're going to have to go into the community. Downtown will not be able to service a city that's already hesitant about vaccines. And so for those who'd like to get it, of course, obviously, they're going to crush through brick wall to get it. But for those who are hesitant and for those who worry, you're going to get a lot of folks sitting on the sideline.
Thank you, Pastor Williams. Father Ameer, Pastor Monica, anything to add? Father Ameer, you're muted.
Sorry. I think the big problem of this, in my opinion, is that the imbalance is showing the fact about the sometimes about the disease or about the vaccine. People hesitate to take the vaccine, especially in the media or social media. They actually trying to spread some scary news, some bad news, some false news about the vaccine, and the scientific and the social awareness of this disease is not stable sometimes. For sure, now the disease is, we don't know about it most of the time, they're incomprehensible in many of its mutations. That's why the lack of confidence by the society for many of the measures that health is doing here. There are, for example, there are doctors who say that wearing a mask is harmful, and others say opposite. Now there's a vaccine, and some they saying take the vaccine, some saying don't take the vaccine, and the lack of this is some of those who working on hospitals, they actually hesitate to take the vaccine too. That makes some of our actually congregation thinking about this. We as a leader, I believe the pastor, they share all those things. We as a leader of the community here, we shared our picture, receiving the vaccine. The leader of the church, the pastors, the priests, the fathers of the church, they shared their actually receiving the vaccine only to encourage our people to go and get the vaccine. Me as a priest, anybody who asks me about receiving vaccine or not, the answer is yes, go receives it. Why? Because in this we can actually come back together and do our social work as we doing it before. But unfortunately is, as I said, people, they listen to the social media more than listening to the expert, those who try and actually declare for us the vaccine and its impact and all. That's, I believe, need to be clear for our community, especially from the specialists, those who working with the disease. They need actually to have the, let us say, they need to unit their facts about this disease and about these vaccines. That's my opinion.
Thank you so much, Father Ameer. Pastor Monica, do you what are your thoughts on the hesitancy versus access dyad?
Yeah, I agree with all of my colleagues who shared today. Father Ameer really uplifts the issue of misinformation in the community, and that really highlights the need to have a community-based approach, which I really heard Pastor Waddles and Pastor Williams also call for. We cannot sit and wait for the government to come. We have to be active, engaged, and bring the vaccine into community. And a lot of times it's a real challenge in our role because we become social service agencies, but we also have to have that arm of advocacy. There are issues of policy that have created the system as we see it, that continue to disadvantage Black and Brown communities, that continue to see the vaccine not be accessible. And what we're really talking about is equity. And what we don't have and need is an actual law and mandate to mandate equity, to make equity the standard. Because I think as we've shared here today, the access is huge. Hesitancy is real, and we can't say it's not. But all of these measures from helping with misinformation, getting the facts out there, being engaged in community, and being connected sites. So in Genesee County, we've worked on this in a number of ways. We do have faith communities, faith sites that are vaccine clinics. We have one, we have 3 of them, all 3 different denominations, geographically across the city. We recognize that people would much be more comfortable taking the vaccine in their community, and particularly in the community of faith, and we've really pushed and been successful at that. We've also started community grassroots navigator programs based on public health. So we're training community members, offering stipends, having some financial compensation, because we're in financial hardship. Lots of families are in financial hardship. So it's important that we not just rely on community to be, or the church or faith to be the place where we give it all. And this has economic impact for our institutions too. And part of the economic and social justice is not only are we working to be compensated, but the individuals we ask to be part of this, that they be compensated for their time, for their expertise, and for their desire to be those connecting people in the community. So we now have we've had a team, I should say. This program has been in existence for almost 8 months, a navigator program. Lay folks are trained, but we do have a couple of navigators who are medical staff, they're RNs as well. And specifically, 3 of our navigators are Spanish and English speaking. We know in Genesee County, we've done a great job at addressing the inequity. We've actually closed that gap. But what we see right now is our Latino Hispanic community is lagging, even in terms of access. And our African American community is also lagging in terms of access. So these are issues we're still dealing with. We talk about transportation, language barriers. In the community, in this community, we know there's over 3,000 households that have been identified as homebound or disabled. Again, this is about getting the vaccine to the people, not forcing the people to get to the sites. And so those are the efforts we're working on, because again, it all relates to equity and to access.
Dr. Marsha, I just want to come right behind you, Pastor Monica. And I got to say, you're spot on. That's the reason why when I started this conversation, I already knew in my mind, I wasn't going to start this conversation without talking about the fact that Southeastern Michigan, Wayne County and Detroit alone got $1 billion. $1 billion. Let me just make it very clear, $1 billion. And everything we do is good faith and good effort? Hell no. We got work to do to get our community vaccine. It shouldn't be no transportation. How you got transportation issues and we got $1 billion from the federal government? It shouldn't be. How do you have location issues and we got $1 billion from the federal government? It shouldn't be. How do you have job? I mean, we need folks to do stuff. And I mean, part of my concern is, and I want to be very clear about this, and I don't want to turn anybody into my political agenda, but part of my concern is this is just going to go into filling budgets, padding budgets, and pet projects for downtown buildings. And it just cannot be. And we've got to sound that alarm. We got to sound that alarm loudly. We are in the middle of a pandemic. Black folk, brown folk, poor folk are not expendable and you cannot dismiss us in vaccine hesitancy. Spend the money in the right place where it needs to be spent and make sure that we get the vaccine. And by the way, let's get the best one that's out there.
And Pastor Williams, you're right on. This is an issue not only for the city of Detroit, for the city of Flint and other municipalities. So we have to be unified in our advocacy efforts to challenge our governments to spend the money in the right ways that serve the people, that aren't padding the projects, that aren't doing all these other things that really have nothing to do with COVID and nothing to do with saving lives, because it's our community's lives, it's Black and Brown community's lives. We're still going to be the ones dying at the end of this because we were last in line and the 110,000th person. So the unified effort, I think, is really important, to push back on these strong government, there is political agenda, in here that has created, again, this system that leaves our communities disadvantaged, marginalized, and left out.
I want to come back to innumerable key points that the 4 of you have highlighted. I'm going to jump to Dr. Cinti for just a quick, I won't say quick question, but a question that somebody sent in. And then I want to come back to all 5 of you about what's the solution. We've talked about, several of you mentioned transportation. That's a challenge. I'm hearing anecdotally in the community the hours that the clinics are open. I have to pick between my job and getting vaccinated. So I want to come back to you to get your insights on what are the challenges like transportation, like hours, what else is there. But I want to jump to Dr. Cinti because I've heard this question quite a bit. Can you update me about trials in children? Will they be necessary as children spread COVID differently, or do they spread COVID differently? Is vaccination important for them for their return to school? Are there opportunities to get involved with the rollout? Can you speak to that, Dr. Cinti?
Yeah, these are great questions. And I was actually looking at that recently. So all of the pharmaceutical companies, and particularly I was looking at Moderna, they're starting to do studies in kids up to 12 years old. And then once that group is fine, it'll be all kids up to the age of 16. Yes, they do spread the disease. Are they super spreaders of the disease? We're not quite sure. They do that with influenza. We're not quite sure about COVID. They definitely spread the disease. And so you can't get 70% herd immunity without vaccinating children. So we're going to have to get there. It should be safe. We have to be much safer when we do these. The adults and kids are quite different, but I think it's going to be safe in children, and we should be seeing that coming out in the next few months. So it is important. It's a good question, and it's very important to get that moving.
Okay, thank you, Dr. Cinti.
Yeah.
To all five of our guests now, going back to the important and appropriately heated discussion we were just having, which is, what do we need to do differently, better, to get people to the vaccine, or really to get the vaccine to the people versus forcing the people to get to the vaccine. What resources do we need? How do we need to rethink it? What are some of the challenges that people are having from learning about the opportunity to actually getting there and getting a poke in their arm?
Well, I'll share a few things. I think one of the solutions, and I'm gonna say it again, got to make sure we spend the money in the right place.
Okay.
All right, so that's one. Second solution is we need community health workers out there in the streets. We need them on the doors. We need them on the doors. We need them talking to folks. We need them not only dealing with vaccine and trying to jam a vaccine on their arm, but dealing with the issues that they have. We need them being able to schedule folks. They need to be able to go in on their phone and schedule them right then and there. We need them to be able to go, call and talk to somebody. And we need them to be able to point them into a location. That's the second thing. We need community health workers. The third thing that we need is we need to make sure that municipalities that are receiving all of these dollars, they set up community stakeholder groups to help them spend the money in the right direction. I know we got city council folk, but you know as well as I know, government folks get their interest and they get in their place where they get focused on what they're gonna do, what projects they're gonna do, and they get off focus. So we need community folks who are involved in these communities to be on the panel and be on the place where they can recommend where dollars need to go and make sure that folks get the vaccine. And if that means that we need to get folks situated where they can get transportation, or we need to get housing, or we need to, that's what we want. That's what the dollars need to be spent for. So it's three things I'm recommending. I'm recommending one, we need to make sure we spend the money in the right direction. Two, we need community health workers. And three, we need a panel or stakeholder committee in municipalities across the state to make sure that these dollars get in the right place.
Thank you, Pastor Williams. Pastor Waddles or Pastor Monica, Father Ameer. Pastor Waddles. Go.
The major thing for me is remove the barriers that are geographical. Because of the former administration's competitive way of allocating resources, it has created geographical barriers. I know people in Washtenaw County who've gone to Wayne County to get vaccinated because it was available by drive-through. And I know people in Wayne County who want to get vaccinated in Washtenaw County but can't because of regulations. We have to remove the geographical barriers and the competitive nature of distribution so that it is equitable, but it's more available, because we won't be able to deal with the hesitancy if when people want to get vaccinated, there are barriers to it.
Okay. Thank you, Pastor Waddles. Pastor Monica, Father Ameer, anything to add or?
I fully agree with what has been shared. And for those reasons, I think of like the social vulnerability index as being important to help guide some of that equitable work in those geographical, issues. And this state had a fight with that. in the legislature with the desire to get rid of it, which was the very thing that helped protect the most vulnerable people. And those who are privileged and who aren't vulnerable, if we do not address those who are most vulnerable, this will continue. It will continue to wreak havoc and harm among all, and this is all. As we see variants continue to pop up, we anticipate that into the future. So I really want to see our community statewide, in our counties, really make the effort to protect those who are most vulnerable. And from my perspective, in my hat as a community organizer with Michigan United, which created the actual Navigator program here in Flint, we need a legislative mandate to do that, because we don't see the goodwill happening in the day-to-day. We wouldn't be here talking about all of the barriers if it were. And so all of that is grounded truly in issues of racism. We need to name it for what it is and not use other policies that really we're trying to tackle a racial inequity issue.
Thank you. Dr. Cinti, do you have any thoughts on this? I know you are as someone who serves as an advisor on a lot of these policy issues.
Yeah, I completely agree. Yeah, I think we don't want to use hesitancy as a way not to get vaccine to people. And I've heard that said many times, that there is hesitancy, but really when you talk to folks, people realizing that this is a safe vaccine will take it eventually. And then we need to, I think our governor has worked hard to get use the social vulnerability index, and I think that is the way to get our the vaccine out to the right groups in the state, and we should continue to do that. Vaccine is about to open up. We should be getting a lot more, but we do have to bring it to people, and so doing pop-up clinics, doing mobile vans to go to areas where people feel comfortable, like everybody here is talking about. Those are all things that we were doing, and it's good. We're being pushed to do that at the university level. We said, okay, we can give a lot of vaccine in our stadium, but not everybody's going to come to the stadium. And so we were really pushed to say, we got to do more. We got to do better. And so I think we have to keep doing that. So, yeah.
Thank you. Thank you.
Dr. Marcus, there was a really important question in the chat that I wanted to, I'm sorry, I didn't mean to interrupt, Pastor. Go ahead.
Okay, I will check the chat, Pastor Waddles. Father Ameer, did you have something to add?
Yeah, I think the main thing is also the motivation, encourage our society, and especially from that doctor side, they need to be clear from all the fact regarding about vaccine, what happened, what is about the vaccine, is safety, is not safety, because we've seen too many things, they actually live in our community, hesitate to go and receive the vaccine. And also, I believe my brothers in service, my brother in faith, they mentioned it, the bare geography, I drive, 40 minutes to go to the facility to receive the vaccine, and my family too. They went actually for 45 minutes.
Father Ameer, we're losing your volume. Can you lean in a little bit? Sorry.
Okay, can you hear me now?
Yes, very well. Thank you.
I believe, the geographical, it's mean a lot of things for us. For me, I drive 40 minutes to go to the facility to receive the vaccine, my family too. I registered, for example, my family actually registered in MICHR, and MICHR, there's another MICHR. MICHR was, let us say, a mile and a half far from my house, but unfortunately, the address was 45 minutes far away from us. It's sometimes. And also there is one problem, when you do registration for the vaccine, it takes a while to receive the message for the appointment. That actually makes some people, get afraid from it on not taking it anymore.
Thank you so much, Father Ameer. We do have a question that came through. What about folks who have had mild COVID-19? Why would they want to get vaccinated? I think I'll ask you to start with this, Dr. Cinti.
Well, for one, so mild cases, you may still be protected by natural infection, but we are finding that the vaccine probably will add what we call memory protection. So a more long-term protection. So we are recommending that everybody, even if they had COVID, mild COVID, severe COVID, get your vaccine to after that. Absolutely.
Okay. This is another question that I think you can kind of answer succinctly for us, Dr. Cinti. I'm just looking at our time. Does AstraZeneca cause blood clots? And I'm assuming they mean that does the AstraZeneca vaccine cause? Mm-hmm.
Yeah, the short answer to that is probably not. There was some, I think it was in Europe, there were some cases of blood clots, but when they look at it, it's not higher than the general population. So the answer is what we're seeing now is no. Once our FDA looks at it, they'll look at all that data. We'll get a better sense. But no, it's a safe vaccine and it's a good one too. So we're coming up with a fourth vaccine now, which is great.
Awesome. And just related to that, Dr. Cinti, there are just a few questions that fall under the has anybody died from the vaccine category. So can you speak to that for us, please?
No, nobody has died from getting the vaccine. This happens all the time. You guys were talking about social media, and yes, you can see people that maybe died soon after getting the vaccine, but imagine if we give 70 million doses of a vaccine, there's going to be, particularly that 65 and over, there's going to be people who die of natural causes in there, but there's been nothing that's been attributed to the vaccine, any of the vaccines, to cause death. So the answer is no.
Okay. And one more question for you, Dr. Cinti, before we kind of get summation comments from our faith leaders. Have you ever heard of chlorine dioxide as a treatment instead of the vaccine for COVID-19?
No, I wouldn't use that. Yeah, I think, and there are treatments, and the vaccine is a prevention, right? There are treatments there, but that's not a treatment for COVID.
Okay.
And it may be toxic, so I would be careful.
Okay, so I just want to say that out loud. Again, and repeat what Dr. Cinti said, we would not recommend taking that for the vaccine, and it could be harmful, in fact, if for the virus, if you take it to treat the virus or to prevent the virus. And so the recommendation is we definitely don't recommend taking that. Okay. All right. Thank you, Dr. Cinti. In our last, I know it's 7, we started a couple of minutes late, so I'm gonna ask for grace to go a couple of minutes over because this has been such a phenomenal panel. I'm going to just, ask for some summative comments, just really, 60 seconds from each of you to any parting words of wisdom, of which you have many. I could give each of you an hour, I realize, but any parting words for lay people listening, to politicians listening, to policymakers listening, that in terms of the change we need to see made now to save our community, continue to save our communities from COVID. I'm going to start with you, Father Ameer.
Always forget about mute my mic. Okay.
Got it that time.
Yeah, I think the main thing is for the
Father Ameer, we're losing your volume again. I'm not sure.
Okay. Can you hear me now?
Yes.
Okay. I think the main issue is most of time is there's political things behind about those things. I think we need to, as a faithful leader, we need to have more specific thing in our hand, like a specific fact in our hand to encourage our community regarding this, because you cannot actually force people to go and get vaccine. You need to enlighten them. You need to educate them to receive the vaccine to done from this kind of pandemic as soon as possible and go back as we were before. That is the main thing I think we need to focus on it and share it with our people, and let the conflict between the politic parties, what they doing it, what they not doing it, let that put it in the side and work with the community, because community is more important than anybody else. Society, it's mean me and you and anybody that we share all those things together, because human being, it's more valuable than anything else. That's what we need to do. Really.
Thank you so much, Father Ameer. Pastor Waddles, your thoughts.
What love is that Christ shows us is doing for others what we would want done for ourselves, and wanting for others what we would want for ourselves. That is the way we have to do healthcare, vaccination, caring for one another, and that will solve the problem if we will do that. I apologize that I'm going to have to leave to go to another meeting, but that to me is the key. And and we must hold people, as Pastor Williams was saying, accountable for what they do. We thank all of our peers for all of your work. It's critical, and we thank you.
Thank you so much, Pastor Waddles, for joining us tonight. I'll give a formal wrap up in a couple of minutes, but please know how much we appreciate you being here and bringing your wisdom, expertise, and the love you have of community and your fellow man with you tonight. We stand with you. Bye. Pastor Monica, do you want to go next, please?
Kind of piggybacking off of what Pastor just said, love is that which holds all things together. And I have seen the faith community play such an important role in that. And my encouragement to government is to not be fearful of the faith community's involvement or of community involvement, because if we're going to be successful in really addressing the pandemic, it's going to come from collaboration, and it's going to come from community government partnerships, and it's going to take the leadership to stand in the gap, because we represent communities of which have been harmed in many ways by government. We have to acknowledge that pain, but we also have to step towards that in order to really bring about healing. And right now we're talking about healing in a whole lot of ways, but first and foremost is to address a pandemic, which is really still taking hold of our communities. When I look around, it's our communities dying from this. It's still of urgency. And so I just really, the word that brings really all things together is love, and it's in the spirit of love that we can do the collaboration. And I encourage folks to be a part of that. And it is out of love that we advocate, that we hold accountable, and that we step into those spaces. And so I'm so grateful to be a part of this and to make some connections to colleagues here and work that is happening statewide, because we're in it together. The pandemic there isn't a soul on this planet that has not been touched. So it will truly take all of us to defeat this.
Thank you, Pastor Monica. And Pastor Williams.
So to C3 and to Dr. Marsh and the great work that you're doing, and thank you so much, Pastor Cinti, and my colleagues and of the clergy. We're certainly very, very appreciative of the time that we've been able to spend together. Yeah, I'll say what I've been saying to my congregation. You have the right to be hesitant, and no one has to force you, and not even myself, to do anything any different than what your mind and your heart. But I want you to be listening to your mind and your heart, and I want you to hear clearly about the direction that you need to go when you want to interface with your family and you want to spend time with the ones who you love. And you want to make sure that you're able to dig out of the hole that many of us have dug ourselves into because of this pandemic, financially, economically, socially, and everything else. And so part of that means that, you may have to consider doing something different. I went ahead and took the vaccine. I took the vaccine because I decided to do what I believe the Bible instructs me to do. Now, it doesn't instruct me to take the vaccine, but it does instruct me to operate on faith. Now, faith is the substance of things hoped for, evidence of things not seen. I don't know about this vaccine. I just believe that God would have had it to be put together and that I would have it available to me to take it so that I could be protected from it. And I'm asking folks to think about that when they think about the vaccine. I'm asking our leaders to think about the importance of making sure that the resources are on the ground. Look, I know it's tempting to service your pet projects. I know it's tempting to fill holes in budgets and try to figure out ways to make political friends and make policies that end up benefiting your chamber of commerce and your downtown business group. But I think it's important to remember that there are people that are dying, and this is for real. And they are dying because they, one, are hesitant or don't have access or it's not available to them. This is not a time to play games with internet and emails and cell phone texts. We got to get out there and we got to get to the folks, and we've got to get to them every which way we possibly can. And if that means we've got to spend every dime of that money on buses and cars and church buildings and organizers and community health workers, so be it, because this is the time that we're in, like a time we've never seen. And I don't want 30 years, 40 years from now to look back and ask, what were you doing? And we were twiddling our thumbs, building another building downtown and not doing everything we possibly could do to make sure that the least lost and the left out were taken care of. That's my mandate. That's the mandate Jesus gave me. And that's the mandate that we've got to go with, I think, as a community.
Thank you very much. Dr. Cinti, I want to give you an opportunity as well. Any closing words?
My goodness, I don't know that I could, this is all what everybody should hear. I'm here to say this is a good vaccine and it's safe. And you know, yes, I'm trying to get all my friends, my family, and everybody to take it. And I've taken it too. And so we want to deal with, I'm happy to do as many of these as we need to convince as many people to take it. And thank you all for your input. This is really, really enlightening.
Thank you. We want to thank all of our, certainly all of our panelists and special guests tonight. Thank you so much for giving of your time, your expertise, like I said, your wisdom, your community involvement, and bringing that here and sharing that with us. On behalf of MICHR, on behalf of the fierce urgency of now communities conquering COVID, the C3 CEAL grant that the state of Michigan received, and on behalf of our partner organizations that co-sponsor these town halls with us, including the Washtenaw Health Department, the Alfreda Rooks and the Michigan Medicine Office of Community Outreach. We want to thank all of you for listening in, for joining us tonight, for having the courage to ask questions and to try to find answers. You know, we understand fear. I'm a physician and I was scared standing in line to get the vaccine. I got it back in December when it first came out. And I remember standing in line and looking behind me and saying, maybe I need to run the other way. And I had to take a moment of pause and say a prayer and say, I'm you know, to Dr. Williams, to Pastor Williams' point, like I'm here on faith. I trust in God. I believe in science. I'm a researcher and I believe in the power of research and the objectivity of that. I probably will be a little more forceful and say, get the vaccine. You know, choose yourself, choose your family over fear, choose your community over fear, choose your life over fear. And we need to do better as a community in getting you access to the vaccine, but strongly consider the vaccine. And if you have questions keeping you from getting the vaccine, please ask them. Please come back to this town hall, reach out to your faith leaders and to your medical experts and get your questions answered so that you will hopefully be in a place where you feel comfortable getting vaccinated and keeping yourself and those you love safe. So on that note, I want to thank the entire MICHR team and CEAL team for sponsoring and organizing this event, especially Amber, Tricia, and Jordan. We thank you for getting this organized. We want to thank Angelica Snyder for being here to translate, even though our translation technology did not work tonight. And we want to make a commitment to you that it will be working next time. So with that, thank you again to our special guests, our panelists, our faith leaders, and to Dr. Cinti, our medical expert. And we look forward to seeing you at next month's event, where we will be featuring some of our county health leaders and to bring their perspectives on COVID-19, the vaccine, and how we can put COVID behind us. Thank you very much. Thank you for sharing that. Thank you. And thank you again, all of our everyone in our audience for joining us tonight. We look forward to seeing you on, again, a Monday, April 19th from 6 to 7 to educate ourselves, to empower ourselves, to inform ourselves so we can make the best choices for ourselves, our families, and our communities. Good night.